Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna go over 4 very common complications for trigger finger surgery. And majority of the patient gonna experience 3 of those complications. But unfortunately, most of the surgeons do not communicate that complication to their patient before the surgery. But before I do that, I'm gonna explain what is trigger finger. I will go over the success and failure rate of the trigger finger surgery, and then I will go over the complications. So what is the trigger finger? By definition, trigger finger is actually scarring and inflammation in the tendon that going from your finger all the way to your elbow. So when you look at this image, so by definition, tendon is a fibrosis that actually cord that attach bone to muscle. So the tendon is actually attached here to your bone and going all the way to your elbow that attached to it, to your muscle, to your elbow. So the problem with trigger finger, it usually happen around these areas, whereas the tendon going down, and by definition, trigger finger is a scarring and inflammation in the tendon, and you can see it in this image. You see the redness here and the swelling, that's actually scarring. So that's a definition for the disease. And when you experience trigger finger, you will experience stiffness, weaknesses, and also locking and clicking when you extend your finger, and stiffness. And it's more common in early stages that you wake up with more stiffness, more locking, and throughout the day that locking decrease, or with movement decrease. But with chronic severe condition, that locking is continuous throughout the day. So it's very important to look at the definition, because we're going to look at the side effect of the surgery, because the same definition of the disease is actually the same complication of the surgery. So before we do that, let's look at the success rate. So this study, they actually look at several studies, and they found that the trigger finger release, which is the surgery, the complication rate from 1 to 31, that's in several studies. And usually most of the complication from wound complication, joint stiffness, and healing. So when we look at those studies, they found that 60% of the complication due to infections, another 80% is a wound complication, which means your wound has not been healed. And the link for the study, I'm gonna leave it underneath this video. There is another study, and by the way, the word complication, that's a very nice name or for failed surgery. So it's based on these studies, and actually they reviews several studies, and this is published by the American Society of Surgery of the Hand. So the complication rate range from 1 to 43. So there is a higher chance that when you have the surgery, if your body develops those complications, which could lead to failure of the surgery, there's a chance of 31% here based on this study, 43% that you're going to have the complication. And what is the complication? What is the side effect that most of the surgeons do not communicate with the patient? When we look at the trigger finger surgery, you can see here the redness is actually the swelling. So actually the complication is inflammation, and that's actually the same cause for trigger finger is inflammation. Look at the second complication is scarring. You can see the scarring here. You have to have a scarring. With any open wound, if your body does not build the scar is the glue that glue the tissue together. So if your body does not build the scar or glue those tissue, that's gonna be open wound susceptible for infection. So scar tissue is actually very essential for our survival. And when you have this surgery, you have to have a scar tissue. If you don't have a scar tissue, that's one of the complication or the failure here that is actually saying infection or wound not healing, and that's 80%. So we need that scar tissue. The problem is if your body build excessive scar tissue, that's gonna cause a lot more complication and could be worse than the trigger finger itself. So it's a common, I see a lot of patients with trigger finger surgery. It's a common side effect that does not communicate between surgeon and the patient that they're going to have a scar tissue, they're going to have inflammation. But the problem is if your body builds excessive scar tissue, you're actually going back to square one where you started with the trigger finger, because that scarring will cause the clicking, will cause the stiffness, and that's why some of the study they found the failure rate is 43%. That's the complication. And the other side effect that's not communicated is pain. You're gonna have pain. With any surgery, there is pain. It's part of healing. Don't think that you're gonna have surgery and it's immediately you're gonna be back to normal. That does not happen. You're gonna experience pain. There is cut, there is shaving inside, there is anesthesia, there's a lot going on that you're gonna experience pain. So the first one, so the common one that everyone gonna experience is a scarring, inflammation, and pain. Infection, that is common side effect, but usually based on the studies, it's probably about 60% of the cases of failure might experience infection. And a problem with the infection, you're gonna build more scar tissue, more stiffness, and dealing with the infection. So those are actually the 4 common side effects for trigger finger surgery. I will leave a link below this video sharing the 3 secret steps that you can do at home to relieve or prevent trigger finger naturally. We'll see you soon in the next video. If you have any question or comment, leave it in the comment section below and I will answer it in the future video. See you soon. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below or go to asterinstitute.com.